You can't replace part of the brain. Like, you
treat them the same.
The source of truth for the medtech industry.
Coexists with the prophets.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s, built $1 billion company that held up high, a lot of things.
State of MedTech.
With your host, Omar and Khateeb.
Hey everybody, welcome back to the show. Now today's guest is somebody whose company I've followed for a long time because they sit in a category of companies where really there's only a tiny handful of them, which I love. And I felt many years ago would be a big trend in the industry, which is hardware that is enhanced and enabled using software that allows you to scale certain parts of medicine through, let's say, primary care. And the company that we're talking about today is Echo Health, which we'll get into in a moment. I like to call it, and I hope I'm not getting this wrong, it's a smart stethoscope. Would you agree with that, Jason?
Hey, absolutely. Intelligent, smart, brilliant, all the above.
It really is. And there's a lot for us to cover. And so we're joined by Echo Health's co-founder and now director of the board, Jason Bellet. Jason, thanks for joining us. I appreciate it.
Yeah, thanks for having me on. A fan of the podcast.
Thank you. I really appreciate that. And there's a lot to talk about with Echo in terms of what you guys are doing now and everything. But before we get into that, maybe we can start with the origin story of how did you come up with this idea and what were you doing at the time?
Yeah, absolutely. And it's funny. I'm sitting, at my dining room table talking to you right now, and I have the stethoscope and the phone sitting right in front of me. And that is sort of the origin of the company. So we started Echo back in 2013 at UC Berkeley while my co-founders and I were actually undergraduates. And the idea was, and I'm going to kind of take you back in time a little bit, we all have iPhone 4s in our pockets. And Nest had just revolutionized the thermostat and Ring had just revolutionized the doorbell. And my co-founder, who was a bioengineer at the time, was doing his senior thesis course and talking to cardiologists about big gaps in the frontline detection of heart disease. And one of the cardiologists looked at his stethoscope and said, well, why can't we make the stethoscope smart? Heart disease is the number one killer. There's 30 million healthcare professionals around the world that wear a stethoscope every day, but it's essentially just a rubber tube. And it's completely reliant on the subjectivity of the human ear. But if we could bring AI to the bedside and help professionals identify early signs of heart disease, we'd be able to get patients into the pipeline for cardiology faster and in line for intervention faster. And so the light bulb went off of, well, let's build the first smart stethoscope, or what we like to call the Shazam for heart sounds. And my co-founder pitched it to me over lunch one day. I was in the business school. Our third co-founder was doing his mechanical engineering major. And what started off very much as a class project and a scoping exercise became an entry into a pitch competition for student entrepreneurs that we won, and then a prototype that we built to raise a seed round. And again, this was sort of right at the peak of student entrepreneurship in Silicon Valley in 2013. And we were really fortunate to meet some investors, including the founders of Shazam. So it became a full circle experience, who believed not only in the power of student entrepreneurship, but in really what we were building, the power of using AI to analyze heart sounds. And we were really fortunate to have some inspiring cardiologists, including at the time, the chair of the medical school at Stanford, who was a cardiologist, who was like, we need this. And now is the time to do it. It was the intersection of, the smartphone, the smart device, and also cloud computing, where you could, for the first time in history, take a 15-second sound right in front of a patient in a physical exam, process it, and deliver a result. In the same way, you could walk into a Walmart, Shazam a song, and get that result in 15 seconds. And so that was really the genesis of Echo. And of course, like anything in healthcare, it's a decades-long journey with a massive amount of investment that we can talk about later in the VC and entrepreneurial ecosystem. But that's really how it got started.
That's amazing. I love the way you position it, which is like the Shazam for heartbeats. Something that I think the audience doesn't quite understand unless they're in medicine is that while I feel like the value for this is very clear for cardiologists, the real value that Echo provides is for primary care, because most, if not all, primary care doctors, like they have to be sort of a, what's it called?
I almost need to be an expert. I mean, they need to be like a tuned ear.
Yeah, well, so it's oh God, what's that saying? Master of all trades, master.
Yeah.
It's like, and so in primary care, they have to know so many things, and so to have your ears attuned to picking up extremely subtle arrhythmias, etc. It's very difficult. And even if you do, like, there could be all kinds of things going on in the office, you might miss it, right? And so I feel like the benefit, and this is why I love companies like Echo, which is the benefit is that you take the expertise of a specialist, use hardware and software to put it at scale through primary care, and now patients are getting screened, and those things are getting caught earlier on in their disease pathway, and then being referred to a specialist sooner, right? Because the last thing you want is, whether it's a heartbeat or any other chronic condition, to get to the point where like anybody, including a medical student, can notice it, because by that time it's already been too late, and then like that disease has progressed to a point where there's like irreparable harm done, right? And so that's why I really like what you guys are doing at Echo. Now, earlier on, what were some of the obstacles you guys faced when it came to driving adoption in the market? Because the stethoscope is such an iconic thing, and most physicians take pride in the fact that, like, oh, I'm so good, I have these skills. So what were some of the different obstacles you guys faced in the market?
Yeah, it's a really, really good question. And love what you said about kind of the responsibility of the primary care provider to do a whole slew of exams and a whole spectrum of analyses in a very short period of time, because you only get about 15 minutes with a patient once a year during that wellness exam. So to do a cardiac and pulmonary and dermatological and mental health, and just the level of examination that they have to do in a very condensed amount of time, means that when you're innovating within that space, you have to look at not only the ability to obviously provide the insights, but the timeline that you can provide them on. And so with Echo, the key was, how can we digitize a heart sound and lung sound? Again, taking something that has been analog for 200 years. So how do we deploy digital stethoscopes at the bedside? But then how do we take those insights, process them through a very complex neural network and an algorithm, and then deliver that within seconds right to the primary care physician during the physical exam? And so step number one for us was the digitization of the stethoscope. And then step number two was making it intelligent. So all of our digital stethoscopes do at most basic and core element is amplify heart and lung sounds and reduce background noise. So if you talk to healthcare professionals, one of the hardest parts about listening to heart and lung sounds is just getting a good sound. And so we're really proud of the fact that we are the Bose of stethoscopes. We help you filter out that distracting background noise in an ER or an ambulance or in a crowded, pediatric clinic. And then we help amplify it, which is especially important for clinicians who are hard of hearing. So first and foremost, we are meeting them right where they are, which is wanting to get really clear, crisp heart and lung sounds. Then, using our mobile app, we automatically pair to the stethoscope. So once the healthcare professional has installed our app on their phone or on the tablet in the clinic, or even on the workstation on wheels that's in the clinic, it auto pairs every time they turn the stethoscope on, so they don't have to engage with the app. And when it is time to actually capture a recording, they click one button, they capture 15 seconds, and we deliver an analysis. One thing worth calling out is we have FDA clearance on our hardware, which are the actual digital stethoscopes. We also have FDA clearance on our software. And you can think of each of the algorithms that we have to screen for different conditions as almost a software as a medical device. In fact, it is as a software as a medical device.
Jason, one of the things I wanted to ask about is that this is a really innovative device, and it makes sense now. Like back then, there's all kinds of risk with this, and of course, a lot of pushback. So you really needed to find very unique investors who saw the vision, right? Who are some of those early investors who invested in that pre-seed round with you, and how did they help you guys get to the point that you are now?
It's amazing to think about the impact that our investors had on our journey, because we started off as student entrepreneurs. And so our earliest investors not only believed in sort of the power of entrepreneurship and wanted to invest in them. In fact, our first investor had a VC fund specifically focused on students building, innovating, and world-changing ideas. And it was Michael Baum. He started a company called founder.org, which they started a fund called founder.org. The company he founded is called Splunk, which has gone on to be one of the most, impactful big data analytics companies. But he believed in what we were building and the impact that it could have on cardiovascular care. And we also had the founders of Shazam, who saw that what we were building in cardiology had a lot of similarities to what they built for music, and appreciated that we were calling it Shazam for heart sounds, and thought that was a really, really application and comparison to what they had built. But as we scaled, we were really fortunate to kind of joined forces with a couple really incredible VC firms. One is Artis Ventures, and their healthcare partner, Voss Bailey, was our Series A and Series B lead and still the chairman of our board. And then we've brought into the fold Questa Capital and Highland Capital, NTT VC, and then some really strategic partners like 3M and the Mayo Clinic. And so it's been both a truly humbling experience to have so many incredible healthcare investors that I frankly look up to join our board and invest in us. We've raised over 125 million to date. And it's an incredibly exciting experience because we've been able to build something that has now crossed 500,000 healthcare professionals across hundreds of hospitals and health systems that is FDA cleared both from a hardware and from a clinical decisions perspective. And so while we have a long road ahead to have materialized what started out as this vision and some of the early investors that took a chance on us is definitely one of our most proudest achievements.
That's fantastic. Yeah, and Artis Ventures have made a lot of really great investment. I'm wondering your advice to other health tech and med tech founders. Do you feel like it's important to get like one of those healthcare systems who have a venture arm? Like Mayo has one, Cedars-Sinai has one. How important was that in terms of your progression with the technology and driving the adoption of it?
Yeah, it's a really good question. I mean, I think I am incredibly bullish on the power of accelerators and incubators. So we actually went through Stanford's healthcare accelerator called StartX Med in 2015, and they were affiliated with Stanford Hospital. So one of our first advisors was a cardiologist at Stanford. He ultimately actually became president of the American Heart Association, but at the time he was the dean of the Stanford Medical School. And so having both Stanford, obviously on the cap table, but the ecosystem of not only investors, but physicians that they were able to plug us into, I think was a huge accelerator for us as a company. In fact, we used to sit in the Stanford and then eventually the UCSF cafeteria during some of our breaks and talk to healthcare professionals and do user research interviews while we were bouncing around between meetings on Page Mill and Sand Hill. And so connective tissue between StartX and StartX Medicine and Stanford Medicine for some of our early success. Later on, I think, finding health systems that have venture arms are a huge growth lever. So the Mayo Clinic collaboration was across both licensing an algorithm that they had built for deployment into our algorithm ecosystem, but also just leveraging the incredible insights of their cardiology team to refine and optimize our product. So I would say that founders do align themselves with some strategic investors and healthcare systems. But I think even more important than that is plugging into an ecosystem. And so there are other ways to go about that than a specific VC fund tied to a health system.
That makes a lot of sense. I think it's really good advice as well, especially, these days compared to like even a few years ago. While capital is a commodity, so I think it's important for founders to really make strategic decisions as to like where they're taking money, not just taking checks for the sake of taking a check, but also the other side of it is having more creative ways of getting funding. Because let's face it, the last like year or two, like if we look at 2023 and the funding environment for medtech, I think overall it was down maybe like 17%. I think I'm going off of memory, but yep. So I think it's very interesting to say that. The other side of it is that I don't think it's spoken enough about, which is the value of these accelerators, right? Because aside from the fact that a lot of times people are first-time founders. If you're not a first-time founder, maybe you don't need an accelerator. But even so, even if you're a repeat founder, I feel like those accelerators are valuable because it gets you plugged into an ecosystem, and just purely through the fact of the network, the things you learn, the people you get connected to, it informs your original hypothesis and kind of pressure tests it.
Absolutely. I mean, it's all about networking, right? Networking with customers, with investors, with press and the media, and telling your story. In fact, sometimes I feel like we were really, really good at this early on in our journey. We went through Stanford StartX, we went through the Berkeley Accelerator, and then you sort of get to that Series A and Series B stage. You actually aren't in as many pitch competitions and you aren't in as many networking events that you have sort of at your disposal as a very early stage, sort of seed to Series A entrepreneur. And it sort of took COVID in a lot of ways and we talked, at one point about Clubhouse and the MedTech Club on Clubhouse and how impactful that was. And it was really a reminder for me to like get back out there And I would go to these conferences and maybe be laser focused on either my booth or one panel that I was participating in. And then really, as we were sort of reemerging from COVID, I've sort of made an effort in my own life to kind of get back into the digital health tech networking community, joining a couple advisory boards, joining Gangels, which is a really amazing LGBTQ plus VC fund that has a healthcare fund. And so one of the most, I think one of the easiest things to drop when you're a stressed out, busy entrepreneur is finding time to network, but you're never too late stage to be planting those seeds and to talk to investors and fellow founders.
Yeah, and maybe if you could take a second, talk about Gangels. First of all, it's a great name.
It
The
is.
second thing I have to say, and this is just me as an outside observer, there's a lot of these sort of angel investment syndicates where it's like on the surface, you're like, oh, great. But then you look deeper and like, when was the last time they made an investment? They haven't really done much. But at least when I looked at Gangels, what I was really impressed by is that how proactive and active they are within the ecosystem. And I really love seeing things like that. Actually, I found about them through you before you came on the show. I was kind of, looking at your background and saw that you're on this. I was like, I haven't heard of this. Yeah. Can you talk a little bit about Gangels? Because I think it's a really interesting thing that people should know more about.
Gangels is the best because they are doing a couple really interesting things. One, they're mission driven. And so they invest in both LGBTQ plus founded in companies, but also minority founded and led companies. So their thesis is not just contained to the LGBT community, but they've taken a really innovative approach to it where they have a syndicate. They have about 2,500 to 3,000 individual angel investors that come together on specific investment opportunities. But they also have dedicated funds. So they have a healthcare fund, an AI fund, an enterprise fund that have LPs and sort of operate and look like a traditional VC model. So somewhere in the $10 to $50 million, I think, are the sizes of their different funds. And those funds focus on much earlier stage investments. So they, for instance, have a healthcare fund that looks at seed to Series A healthcare companies. And I'm an LP in that fund, but also an advisor. And so we get to look at companies like Echo back in 2013 and 2014 and make direct investments to help accelerate them from really their seed to seed stage. But then for really interesting opportunities, we can take those back to the 2,500 to 3,000 investors and top off and raise a much larger or significant funding round. And so to your point, Gangels did over $500 million in syndicated investments in the last couple of years, which is really a mind-blowing amount. I mean, you're talking like
that's
competitive.
Not something you would expect.
No, it's not.
Like an angel syndicate. And
it's not a regional syndicate. Yeah.
Yeah. And for people who are listening, I just want to make sure that that they know to check it out. By the way, I love the name. So Gangels is spelled Gaingels. So like gain as in you gain something, angels, so Gangels, GAINGELS.com. So if you want to learn more, go check it out at Gangels.com. But I think it's fantastic. And that funding amount is insane.
I mean, they are one of the top 5 largest digital health investors and have been named that over the last couple of years, just between the syndicated investments that they're making and the standalone fund. So it shows the power of community when you can get a diverse group of minority investors to come together and make these types of investments and the influence that they're having on the ecosystem. So I'm proud to be a part of it. And I think we need to see more of digital health. And so definitely personally happy to talk to any founders looking to raise and interested in talking to Gangels.
Yeah, and I'm just checking their website. I mean, they made some impressive investments. Like outside of the healthcare sector, they've invested in, let's see, I just saw it and I was like, wow, that's pretty impressive. So like Brex, Masterclass, Carbon, Bolt. And then in the healthcare sector, for those who are wondering, like Cerebral is one that pops out. Carbon Health is another one. Elysium Health. Yeah, so it's it's like really. So for those who are interested, again, go to Gangels.com just to learn more. I'm wondering, just real quick, as we depart, because I want to get into a little bit more about what Echo's doing these days, because
sure.
you guys started off as a heavy B2C company. Earlier in my day, when I was trying to bring growth marketing to MedTech, I used Echo as a great example. As like, hey, like these guys, yes, they're BDC, but here's how they are marketing using Instagram and paid advertisements, everything directly to physicians. We can do the same thing. So I know you're more on an system side as well now. We'll get to that in a moment. But real quick, something I feel like a lot of founders don't get a chance to say thank you, but more importantly, share the story is like in those early days where you're getting started, you go through a lot of ups and downs, a lot of hard times, a lot of growth, like personal and self-development. What were some of the things that maybe your investors told you that was painful, that was hard, that made you better as a leader, as a founder? Does anything come to mind? Anything in particular?
Yeah, it's such a good question. I mean, one was just an obsession with the customer. And I remember Michael Baum, one of our earliest investors, who was the founder of Splunk. One of the first people he connected me with was the head of customer success from Splunk. And I went to go visit the headquarters and learn about their customer experience and customer success operation and how critical it was for them growing into what is now, a $5+ billion market cap. And in fact, it's probably even more than that. But it really was from our founding days critical to us that the experience that we offered our healthcare professionals and our community really stood out from other direct-to-clinician healthcare companies. And so we've always invested in our customer support and that you can call and get a live person and sort of no questions asked responses should something happen in the field. And so that advice, this sort of customer obsession approach, both from a individual perspective, so when we look at our direct-to-clinician channel, the customer satisfaction and NPS scores that we have at Echo, which are some of our proudest achievements, but then also on the enterprise side and getting out into the field and getting to know the health system executives and the telehealth directors and the chairs of primary care and cardiology who use our products and are bringing it into their system. I think it's so important for any entrepreneur to have their, first 50, 100, if not more customers on speed dial. And so that was probably, go ahead. Yeah.
Oh no, I'm just agreeing. Yeah. I'm just saying, yeah. Like I'm nodding my head a lot.
Yeah. It's really fun. Get out there in the field. You end up being on the road a lot. I've traveled the country as Echo has grown and had an opportunity to, literally be in every single corner of it. Some of the most emotional experiences I've ever had. I went to rural Southern Alabama to an HIV/AIDS clinic that was using our products for telehealth because a lot of the physicians couldn't access a certain patient population. And so the Alabama Department of Public Health was buying our devices, sending them to rural clinics, and then offering telemedicine services to HIV/AIDS patients. But in going and visiting the site and seeing, even this probably was in 2018, 2019, the stigma of that, of both the physicians and the patients who are dealing with HIV/AIDS, horrible environment that they had to sort of operate within in terms of the prejudice and the bullying that these physicians would get from their other providers or from their family members for treating that patient population was absolutely mind-blowing to me. It took me, especially as a gay man, it took me completely by surprise and out of my bubble. And it wasn't until I went to that clinic, sat with those providers, talked to them about the use case, and was so proud that our products allowed a patient to go into sort of a safe place, a rural part of Alabama, and be seen by a world-class clinician sitting 500, 1,000 miles away who could help them with their cardiac care because our products helped unlock that telehealth capabilities. And I guess pragmatically, if you're wondering how that actually worked, we were able to digitize the heart and lung sounds and then stream them like Skype for heart sounds, 500 to 1,000 miles away to a provider. But yeah, it was stories like that. Both made the impact we were having feel very, very real, helped me understand areas where we can improve our product and our positioning and how we could support providers. And then I've obviously had much less emotional experiences like that, where I've had an opportunity to follow a user around and get some feedback from them. Most recently, actually being at UCLA with my grandma about 2 weeks ago, when 2 healthcare professionals with our products walked into the room and we spent about an hour just getting feedback on what was working and what could be improved. So I think that customer obsession helped us overcome a lot of challenges.
That's fantastic. And I'm happy you mentioned that, especially, mentioning the NPS score, which is because I know my industry well, that's a net promoter score. And it's an important score to have because it objectively figures out, like, are we doing a good job and are we making our customers happy? And I think this is one area where there's not enough emphasis in our industry and it doesn't make sense, right? Because the valuations of the majority of med tech companies is really not based on the placement of the product. It's based on the utilization of the product. And utilization happens when you set customers up to have great success. Their time to value is super, super fast, and they love what they're getting. And so I think not enough companies, like, first of all, let's look at our usual med device company. There's no such role as customer success. They have like clinical and everything, but they don't think about customer success enough. And my belief is that, if you can't make 5 physicians absolutely rave about your product and, more importantly, your company, right? What makes you think that you can do that with 100 or 1,000? Like, it doesn't get easier, it gets harder. So I'm really happy that you mentioned. And again, I feel like Echo is again in a funny way one of those companies that straddles the line between you are a medical device, but you're born and raised in a tech environment, in the sense that you think of NPS scores, you think about customer success, all these different things that normally med tech companies don't do. And I feel like hopefully that's going to set a new standard for other companies to come and founders.
Yeah, it really is sort of the collision of 3 identities. There's obviously the traditional med device in terms of our quality and rigor of regulatory oversight and the seriousness with which we take our clinical research and validation and manufacturing. And it is a medical device all day, every day. But we also, in terms of how we go to market, looks a lot like Figs. It looks a lot like Lululemon or Ring or some of these direct to consumer, either CPG or consumer electronic brands, which live and die off of their NPS score. They live and die off of the relatability of their Instagram ads and their Facebook ads and the relationship that they build with the individual customer. And those brands have always been, particularly Figs, really, really inspirational to us in terms of how they market their products and the relationship that they build with the customer. And then on the software side, we have enterprise software. It's AI for better clinical decision-making at the bedside. And so we take best practices from the Salesforces and, the Zendesks and the big enterprise software players in the Valley in the Splunks, in terms of how we build best-in-class customer success, account management, and really drive for that software retention and growth. And so it's been probably one of our greatest challenges and one of our greatest assets is sort of the collision of those 3 types of models and identities.
It's fantastic. And, that's kind of a good, segue. So, recently you had some big news that you're rolling out your AI-equipped stethoscopes to primary care practices across the UK, specifically led through the Imperial College of London. And this effort, which you guys are calling Tricorder, inspired by the Star Trek handheld health scanner, which I love, by the way, is this very large deployment that's being funded by the NIH version of the UK, right? Can you talk to us a little bit more about that?
Yeah, absolutely. And I want to take a quick step and just step back and just talk about how we see our products being used by a health system at the bedside, because we've talked a lot about kind of the direct to individual clinician and the ability to give them better amplification and noise reduction and that real-time decision support. But one of the most powerful use cases for our products, we believe, is an integrated delivery network like the NHS or like some of the major ones in the US that have owned primary care, where they can influence which technology gets deployed and work really closely with primary care leadership to roll out an AI-enabled stethoscope. But then have patients, if they are detected with early signs of heart disease, get referred into the cardiovascular and CV service line. And that connective tissue between primary care and cardiology is obviously so critical in terms of driving better patient outcomes, but also means that if we can flag patients earlier and with greater accuracy, you then have the ability to treat those patients faster and get them into the pipeline of care. And to be super specific, Echo has a couple of algorithms that screen for different conditions. So today in the US, we have FDA clearance for AFib detection and structural heart murmur detection. So we're looking at, when we put the stethoscope up on the patient's chest, we can flag a clinically significant structural heart murmur, that it could be an indicator of valve disease, and get that patient referred to the valve center where they may be eligible for treatment, including up to getting a replacement artificial heart valve, which is a fascinating procedure, by the way, which we could spend an hour talking about. But one of the algorithms we're really excited and bullish about is low ejection fraction detection. And that is an algorithm we built in collaboration with the Mayo Clinic to look at ejection fraction detection below 40%. So with 15 seconds of ECG captured with the ECG electrodes that are built into the chest piece of the stethoscope. So if anyone's watching, I'm pointing to the electrodes. We're able to run that through our algorithm and detect EF below 40%. So this is still investigational in the US. It's actually FDA pending for a 1 to 3 for 1 lead EKG. But in the UK, we were able to secure clearance, and it's actually being deployed as part of a 200 clinic study with Imperial College London with some really, really exciting results. So real world clinical validation of the power of detecting low ejection fraction at scale in primary care. There they call it GP practices, with the whole premise being patients over the age of 50, when they come in for their wellness exam, making this 15-second screen part of their annual checkup.
That's fantastic. And, for low ejection fraction, first of all, I mean, you guys are catching it at a critical time, but maybe walk for the audience just to understand, how is it normally checked?
Yes, great question. So low ejection fraction is essentially a weak heart pump, is helping identify heart failure with reduced ejection fraction called HFrEF. There's really sort of two types of heart failure. There's HFpEF, which is preserved ejection fraction, and then reduced ejection fraction. Reduced makes up about 50% of heart failure cases. So it's a really, really significant percentage of patients with heart failure. Unfortunately, unless the patient is exhibiting symptoms, really the only way to identify it is through an echocardiogram. So that's a couple hundred to a couple $1,000 diagnostic test, depending upon where it's being performed, but requires the GP or the PCP to refer that patient to the test based off of some sort of clinical suspicion. And then, of course, as we know in the US, we have multi-week wait times for echocardiograms. And actually in the UK, they have multi-month wait times for echocardiograms because the system is so backlogged. And so this offers, where an echocardiogram is a diagnostic test, this is a detection tool. So it's not necessarily apples to apples. What this allows you to do is to do a quick assessment, flag low ejection fraction, and then accelerate that patient, certainly with more urgency if they've been detected to have low ejection fraction.
Yeah, and I really love that concept because, again, I think that the future of medtech is hardware that's software enabled, and you do things like this to catch things earlier and sooner. Because the fact of the matter is, first you have to assume that the GP is good enough to recognize, right, low ejection fraction. And because of the way healthcare systems function, you're usually not seeing a GP, right? You're usually seeing a nurse practitioner. No offense to them, but again, they're trained in so many different things. So you're kind of based on the luck of the draw. Like, is this nurse practitioner, or even physician good enough to pick this up, right? And let's just say that they are. If they are, you have a compound effect where, because I went through this myself recently because I have a family history of heart disease. And so I needed to get an echocardiogram and everything. I knew it, and it took me at least 2 months to do it just based on my schedule, right? And so there's compounding effect, especially with depending on the patient population, right? Where maybe it may not be even a few months. If it's something that's not pressing you, it's not giving you pain, people will put stuff like this off for years,
Well, and that's just right. I mean, 50 million Americans live in a rural area, right? Where they're driving hours to go get an echocardiogram and taking days off of work.
Take time off and everything.
Yeah, it's a big deal. And I think to your point, even if they are able to get it, echocardiograms take a significant amount of time just in terms of just exam time. And so it's not feasible to do an echocardiogram on every patient every year. Even in the world with POCUS and handheld ultrasound, I think there was, a period of time 5 to 7 years ago where there was a lot of buzz about maybe the stethoscope is going to be replaced by POCUS. And I think POCUS is an incredibly powerful technology. And I actually see our smart stethoscopes and smart ultrasounds living really symbiotically in terms of the patient funnel and the patient flow. But the fact remains that in that 15-minute physical exam and in the 2-minute cardiac exam, you have to be able to put that stethoscope up on the chest, get a really quick result, and you don't have the time, again, unless there's significant clinical suspicion, to do an echocardiogram on every single patient. But we have been blown away by the percentage of patients who come in without symptoms of heart failure, And we've seen this in the UK, but end up having a flag of ejection fraction below 40%, and then go on to receive a confirmatory diagnostic echocardiogram, and then are eligible for treatment months, if not maybe years, before they would have been otherwise. And that is really life-saving because you're able to catch them so early.
Yeah, it's a great point. And again, like for me, in my previous life when I was in medical school, I have all these books that have been written over time just on different areas of pathological diseases. I think what's interesting is that when you have hardware that somehow either automates a process, or in this case, automatically captures data in real time at such high frequencies, then you're able to take that data and really change standard of cares. Because based on, like, let's say Harrison's internal medicine, certain levels of ejection fraction, I think if it's under, I'm doing this off of like memory, I think it's like, if it's less than 60%, it's considered low ejection fraction. But based on the data you guys are getting, you might be able to have higher sensitivity and say, no, it's actually when it's below 75% or something. So that's going to make a huge change in terms of how early can we catch these diseases, because now as we progress, especially with the biohacking movement, longevity movement, people are living a lot longer. Our bodies were not, created to live like that long. And so there's gonna be all these chronic conditions that need to be caught earlier and earlier and earlier so that can be managed through therapy. So I think Echo sits in that position for a lot of things.
Yeah, it's funny you mentioned sort of the nod to the tricorder name, because I think it is a very clever name. But I also think it's important to say that it's not science fiction. Like this is now. We now have tools, 15, 30 seconds you can apply to the chest, and using cleared AI. In the US, it's AI for AFib and structural heart disease. And of course, in the UK, we also have low ejection fraction. You can screen that patient for a host of life-threatening conditions. And I think what I'm so bullish about with Echo is now that we have this install base of 500,000 healthcare professionals in our community, and that's growing significantly year over year, but also the ability to build these algorithms, we're just getting started. I mean, we have a pipeline of algorithms that go 5 to 10 years out that are looking at various pulmonary conditions and different cardiac conditions. And so I envision a future where you put the stethoscope up to the patient's chest and you can screen for 5 to 10 different conditions in under a minute.
That's amazing. Just as we kind of round things out here, and again, I appreciate you coming on. Now that you've rolled this across the UK, and eventually you guys are going to cross the pond and come to the US, let's say 5 or 10 years from now, your biggest dreams realized. What's the vision for Echo being deployed across like major healthcare systems? Like, what does that look like in practice?
Yeah, I'm so glad you asked that. I want to walk into a physical exam in the coming years, and without planting it, have my healthcare professional use an Echo stethoscope on me. Because I do seriously believe that in order to deliver the best care possible, we need to marry AI clinical decision support and digital devices, which is sort of how you started off the interview, the combination of connected devices and AI with the unmatched expertise of a human physician. No one, I think, is saying that we should replace the ears of a clinician, the eyes of a clinician, the know-how and knowledge of them. But I think we're all beginning to appreciate in 2024 the power of augmenting our human abilities with artificial intelligence. And as a patient, I want to be able to walk into my physician and know that my heart is not only just being listened to, but is being analyzed with the best tools possible. And I think there's companies that are doing this for cardiology, obviously with Echo. There's DermaCenter that's doing it for dermatology. And so I do firmly believe in the connected physical exam and the AI-powered physical exam. And I think Echo is going to play a huge role in taking that from what may have been science fiction sort of 20 years ago and 10 years ago when we started the company as sort of a dream and a mission to, over the next 5 to 10 years, very much a reality. And I'm so proud to say we have 500,000 healthcare professionals that are along this journey with us. And the next 2 to 4 to 5 years, I hope we can far exceed 1 million, if not 2 million here in the US. And I think the other thing I really want to emphasize is just the power of taking this internationally, and particularly in underserved and under-resourced areas from a global health perspective. Because you put 10 of these in a community that doesn't have an echocardiogram machine, that doesn't have a 12-lead EKG machine, and you now have the ability to help detect cardiovascular disease in a population which is not getting access to even sort of baseline diagnostic testing today. So the vision to bring it full circle, I want this to be a standard of care. And I think that's kind of a cliche answer, but it's just the reality. And it's what we're all working for and are willing to spend as much time as it takes to get there.
It makes sense. You don't have to be a clinician to understand and see the value of it. By the way, I did notice that you are now an advisor for one of the other companies that I love, which is DermaSensor, and I've been talking about them for years, which kind of again fall into this category of, hardware enabled, software enabled hardware that takes the expertise of a specialist and puts it at scale through primary care. Because even if we wanted to, we don't have enough. I think for for dermatology or another specialty, I think it was for every one specialist, there's like 11,000 patients. Like you can't scale that, right? So the only way you can solve that is through tech. So my last question to you, and let me grab my prop. My last question to you is that my father's a general surgeon, and when he trained at Cook County Hospital, they gave him this black doctor bag. He passed this on to me, when I was going to be a doctor. So in here, actually, I have, and actually, like I should pop it out open because I haven't seen
do a show and tell.
Quite a while. Yeah, like here's my original Littman, man.
Nice.
That my dad bought me with my name inscribed on it.
Aww.
But the doctor bag of the future. What tech-enabled tools do you put in here? So obviously the Echo Health smart stethoscope goes in here. What else do you put in this bag?
Yeah, I like how you said obviously, because I like to think it's obvious, but our challenge is to make sure everyone thinks it's obvious. Yeah, exactly. No, I mean, I brought it up earlier, but I mean, working with the DermaSensor team and seeing what they're doing for early skin cancer detection. I mean, I was so excited when I had the opportunity to meet them, because I saw so many parallels to what we've been building at Echo for pulmonary and cardiac early detection. And so it is rare to meet a set of entrepreneurs and founders that are building a connected device with FDA cleared AI to identify another life-threatening disease state. I mean, to have an opportunity to work with them has just been so much fun, and they've had an amazing year with their FDA clearance. So that's got to be in the bag for sure. We talked a little bit about POCUS. I do think while it's not necessarily feasible to use it on every single patient, if you do hear a structural murmur or you do see a flag for low ejection fraction, the ability to then immediately do a point of care ultrasound and save that patient months of waiting, potentially thousands of dollars, and also just get to an answer faster, particularly if it's life-threatening, is mind-blowing to me. And of course, the POCUS pairs with the phone. And I think we're just scratching the surface. And I know that Apple and Google and Amazon are all looking at how we step on the gear, but on what we can do in terms of using the phone as a clinical decision support tool and diagnostic aid. I think I mentioned, when Echo was founded, our first app was built for the iPhone 4. It was early days. There was no Apple Watch. There was no Live Core was just coming out. I think they've got to be in the bag too, by the way. But just to see our evolution right alongside the standardization and integration of the smartphone and tablet into provider care has been really exciting. So, hey, I think if you walked into with your doctor bag and had an iPad, a Live Core, a Butterfly, an Echo, and a DermaSensor, I'd be pretty comfortable as your patient.
Do you mind? I'm going to throw something in there.
Yeah, throw it. What else do we need? Yeah.
It does not exist. And I think it's going to be really hard. I think what Theranos was trying to do, it would have been amazing, right? Which is just through a single drop of blood, you're able to get like a full metabolic panel and CBC and everything. I think that would be amazing. Me personally, just what I'm excited most about medicine is that maybe it was COVID or just because of the trends, the average consumer's gotten more interested in their health. So I have a Whoop device recently. I was wearing a continuous glucose monitor. So there's all these different ways where consumers are starting to manage their healthcare.
Yeah.
And I think for telemedicine purposes, it's great. So I would throw something like that in there, but there hasn't been a company that has come out to try and do that yet. Maybe because, Theranos kind of screwed that all up.
The dust still may need to settle there for a couple more decades. No, I think you're right in terms of, we just think about the last 3-4 years and the fact that half the country is now comfortable doing an at-home rapid PCR or rapid antigen test, and the potential to send testing kits to the home to accelerate or to show up as the physician with your bag or clinician for a home visit and be able to do some pretty powerful tests. We've been blown away by the power of patients, the interest and ability of patients to take control of their own health, particularly over the last 3 to 4 years. And I think the pandemic got everyone more socialized and comfortable with telehealth, and it would have taken decades to make that sort of progress. And I think there's been a little bit of a regression, obviously, back to in-person care following the pandemic. But even looking at our products at Echo, I mean, we do think that there's an incredibly powerful path to giving patients the ability to manage their own heart health. We've announced some partnerships on the home heart failure management side, and I think we're sort of just getting started there.
That's fantastic. Well, Jason, look, I really appreciate you coming on the show. It was great to have you on.
Would love to chat.
Where can people find you online?
Yeah, I'm a LinkedIn guy. Send me a LinkedIn request. We'll be at the American College of Cardiology conference in a couple of months, so would welcome. I think it's early April in Atlanta. So if any cardiologists are listening, come swing by the booth. But no, I'm the good and bad, and I'm very much available on LinkedIn, and so would love to continue the conversation.
Fantastic. Well, thank you, Jason, for coming in and spending some time with us. For those who are listening, give Jason a follow. Go check out Echo Health. I'm your host, Omar M. Khateeb, and we'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who'd really enjoy and appreciate it. Share and spread the love. We'll see you all next time.